The term we see many times, anxiety disorder, what does that mean?
Increasingly, children are coming in with higher and higher rates of anxiety disorders. Now, anxiety tends to run in families. It tends to be genetic, but still, it's the stress and the pressure that seems to be bringing it out now in earlier ages. When I first started my practice, I really didn't get many kids complaining of anxiety. It seems to be it's becoming so common. I have kids who, out of anxiety, some of the symptoms of anxiety, obviously, nervousness, worrying, anticipating dreadful events. Their mother leaves driving somewhere. They're afraid she's going to have a car accident. They have to call her on the cell phone 5 times to make sure she's okay. We all know about the little kindergartner who goes into his first day of kindergarten. He's clutching his mom's hand, and all the other children are separating from their parents. He's clinging and has to be coached and cajoled into the school building.
And is this a kind of disorder that's treatable with talking or needs medication?
If it's really heavily family genetic, they're often, not necessarily in childhood years, but very often eventually medication does have to get used, especially if you get a what we call it school refusal or school phobia. And there you get a situation where a kid is terrified of going into school and they're not making it up. It's not a kid who's being defiant and oppositional. Those kids often will need some medication, but they tend to give them very light medications to help with their nerves. But no, most of these things can be treated without medication.